This is a fetus where the difficulty is the position. We can see that there's a large ventricular septal defect, but it's difficult to otherwise see much in the heart when the baby's in this position. So we move the mom until we get a much better position. You can see that there is a left-sided descending aorta. And there's a relatively normal four-chamber view, except that the angle is over towards the left, like 90 degrees. Here we see a large overriding aorta, and both ventricles pumping into that aorta. Here we see a smaller pulmonary artery bifurcating towards the left and right, and it is about half the size of the aorta. So we have small pulmonary artery, large aorta, small superior vena cava on the right. Here we see a ventricular septal defect formed by malalignment of the conal muscle, such that the conal muscle goes into the right ventricular outflow tract, therefore narrowing the right ventricular outflow tract, while making the left ventricular outflow tract to the aorta much wider. This is the hallmark of Tetralogy of Fallot. One needs to make sure it's not a right aortic arch. And you also want to see if there's a ductus arteriosus that is flowing from pulmonary artery to descending aorta rather than from the descending aorta back into the pulmonary artery, which would suggest a more severe type of Tetralogy of Fallot. And patients like this, we follow right through until delivery just to make sure that the right ventricular outflow tract does not get smaller.